A recent report by the Corporate Accountability and Public Participation Africa has sparked debate on how to tackle obesity and diabetes in Nigeria. The report, titled Potential Fiscal and Public Health Effects of Sugar-Sweetened Beverage Tax in Nigeria, proposes a significant increase in SSB taxes from the current 10 naira per litre to 130 naira per litre. And to unpack these, I'm joined live in the studio by Dr. Ogho Okiti, CEO, ThinkBusiness Africa. Good afternoon. Glad to have you join me.
Good afternoon, and thank you for having me this afternoon.
Let me start with your impression of the proposed increase in tax from 10 to 130 naira for sugar-sweetened beverages.
I think I said in the previous report, the report by CAPPA was actually very pivotal. It's a very important report in the journey of understanding the growth in diabetes and growth in obesity in Nigeria. However, the challenge with the report was that it saw increases in SSB tax as the silver bullet to reducing that growth, and that is not the case. SSB and of course obesity and diabetes are much complex, and there is no direct causation. There's a correlation, and of course there's contribution by SSB, but there is no direct causation between SSB and of course the growth in diabetes and the growth in obesity. So if we go by the analysis that they did in their report, increasing that SSB current 10 naira per litre to 130 naira would not solve the problem. So we are trying to look for how to solve the problem here, but what they have come up with will actually not solve the problem, and the reason are three. One, the data that they use are actually weak. The data is very weak, and of course there are discrepancies in the data. One of the discrepancies is that the BMI, that's the body mass index data that they actually use, suggests that women are more obese than men. However, in the consumption of SSB, men do actually consume more SSB than women. So that does not match at all. The second point is that the report, the BMI data that they also used, is an aggregation of different surveys from 1990 to 2017. So that looks like, so much data. However, if they had monitored, let's say 500 or 1,000 or 2,000 people over the same period in terms of their consumption of SSB and the growth in their BMI, we'll be able to trace the dynamics. But that report did not do that. It just do static surveys from different places, and that was the problem. In terms of, yes, go ahead.
I'll come back to the details of this report and then the loopholes, which you have rightly pointed out. But then do you think these proposed tasks could likely stifle industry growth?
Absolutely, and I think that's the point. If you are going to increase taxes, the taxes must have an objective. And the objective of the taxes that they have, the objective of what their own objective is to control diabetes and to control the growth of obesity. However, these taxes, where anytime it is increased, will not solve that problem. It will rather stifle investment, jobs, and growth of the industry. So that's actually the problem. The fiscal solution will not solve the health problem that it is meant to solve, and that is exactly the point that ThinkBusiness Africa has made in its own report. Okay,
just to reiterate what you mentioned earlier on, you talked about no direct correlation between SSB and of course obesity or diabetes, as the case may be. But then beyond all of this taxation, what other measures do you think can be employed to address health concerns related to sugary drinks in Nigeria?
That is a very excellent question. So let me go back to the data that they use. The BMI data that they actually use, the conclusion in that report, that's Adebola of 2021, the conclusion of that report said that the causes of BMI, that's the cause of growth in BMI, is sedentary lifestyle, consumption of processed foods, and urbanization, and of course increase in income. So there are so many factors that actually lead to the growth in obesity and the growth in diabetes. So it is not just the mere consumption of SSB, which obviously there's also a correlation and it actually contributes. But what we are saying, it is much, much complex than that. I may be obese, but not necessarily because I consume SSB. So if you actually increase the taxes on SSB, it may not eventually solve my problem. And it is that linkage, I believe, that we need more data, we need more understanding, we need more analysis before we come to the conclusion of whether it is important for the taxes to be increased or not.
You rightly pointed out the loophole in this report, saying that there is no direct correlation when it comes to SSB and obesity or diabetes, as the case may be. What would be your recommendation in carrying out a report which is close to infallible?
Okay, so for me, I think two things. One is that can we monitor obese and diabetic people over time? So we get a good data of monitoring them over time and monitoring their consumption of SSB. That's number one. Number two, to understand where they are, to understand their environmental conditions, and to understand all other things that contribute to that. That's number two. And number three, we've had SSB of 10 naira per litre since 2022. How has that helped so far? As that there's no data, there's no evidence to suggest that the introduction of that tax has actually reduced the consumption of SSB. So it is, if it has not reduced, it is not conclusive to say, oh, because it is not adequate, or because the elasticity is not sensitive enough. It is not. We can't just suggest that. We need to also understand what has happened since that introduction and whether the resources have actually been targeted at controlling the growth of diabetes and controlling the growth of obesity in Nigeria. We don't have data, we don't have that evidence, and we are not sure where we are in relation to the resources and to the problem it is that we are trying to solve in Nigeria in that regard. And I think those are the things that we need to do. So there are 2, 3, 4 other things that we need to do before we come to the conclusion of increase in SSB tax.
Thank you so much for your expertise and, of course, your kind company. Dr. Ogho Okiti, CEO, Think Business Africa. Thank you once again.
Thank you so much for having me.